Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Yasir Balla Abdullah. I'm a consultant physician, Hudan Hospital. In this short video, I want to talk about diabetes and Ramadan, focusing on who's going to fast and who's not going to fast. Before starting, I want to mention two advices. Firstly, all patients with diabetes must consult their treated doctor to be assessed during and after Ramadan for evaluation of their diabetes control, medications regimen, complications, and dietary recommendations. Secondly, during Ramadan, patients are encouraged to monitor their blood glucose level regularly. If the blood glucose less than 70 milligram per deciliter or more than 300 milligram, should break their fast immediately. Then we will go to who's going to fast and who should not fast. We will be guided by the recommendations of the International Diabetes Federation, IDF, which has introduced a risk stratifications tool that categorizes diabetic patients into three groups based on their ability to fast safely. The high-risk group individuals should not fast due to significant health concerns. And the criteria of this group are uncontrolled patient with uncontrolled type 1 diabetes and type 2 diabetes with the poor glycemic control, I mean hemoglobin A1C level above 8.5%, or diabetic patients with severe complication like severe neuropathy, severe hypoglycemia with the last 3 months before Ramadan, or history of recurrent hypoglycemia, or history of DKA with 3 months before Ramadan, or hyperosmolar hyperglycemic coma with the last 3 months before Ramadan. Other criteria of this group are serious comorbidities like cardiovascular disease, patient with heart failure, patient with stroke, patient with chronic kidney disease, especially stage 4 and stage 5. Other criteria in this group is recent change in the medication regimens, pregnant lady with uncontrolled diabetes or pregnant lady on insulin. Other criteria is old age who is living alone or old age with ill health. The other group is moderate risk group, and this group includes individuals who can fast but with cautious. The criteria of this group are glycemic control between, hemoglobin A1C between 7.5 and 8.5, or patient with mild complication like early stage neuropathy, mild retinopathy, and patient with mild or no comorbidities like stage 3, for example, stage 3 kidney disease, and pregnant lady with controlled diabetes with metformin or diet. The things that I want to mention in this group is those groups, they request adjustment in their medication regimen during Ramadan. The last group are the low risk group individuals. In this category are generally considered safe past Ramadan. The criteria of this group include controlled diabetes, hemoglobin A1C less than 7.5, and short duration type 2 diabetes with absent complication. The medications in this group usually they have oral hypoglycemic agent or insulin. So we can say this group are type 2 diabetes with short duration with hemoglobin A1C less than 7 with no complication and no comorbidities on stable medication regimen. So the last point that I want to focus on, all patients with diabetes should visit and consult their doctor because they need adjustment of their medications and to evaluate their complication before Ramadan.